questions today. I decided this morning that I was going to do an Instagram live just answering your questions, because every day I receive so many questions from women actually all over the world who have got questions, and it's really sad because they can't seem to get those questions answered by other people, or they'll be given incorrect information or advice. I don't know why hormones cause so much confusion for so many people, but it's happened for decades. So what I'm going to do is just try and answer as many questions as I can. They're in no order. The order is the way they've come. So it will be a bit chaotic and jumping through different topics, but I'm literally just going to read out the questions and answer them. So I've got them all on my computer here. So the first one is, I've been on HRT for 12 months, flush and insomnia gone, but joint pain awful. On 100 microgram patches, my doctor's not helping. So with hormones, the most important thing is having the right dose and the right type of hormones for the right person. So we're all different in the way we metabolize hormones, the amount we need, whether we're producing any in our body, and also the way we absorb them is really different as well. But also there are lots of symptoms that are due to other reasons, but also not just due to estrogen as well. And I've spoken many times before, it's about the three hormones, estradiol, progesterone, testosterone. They work in a similar way, but differently as well. And so joint pains can be related to low progesterone or low testosterone as well. Certainly if I saw someone like this in my clinic, I would often do estradiol blood test levels, and if they're low, it would suggest that the 100 microgram patch isn't being absorbed adequately, so might increase the dose and might think about testosterone if levels are low as well. And obviously thinking about other reasons for joint pain too. Is there a relationship between high cortisol and hormones and menopause? Yes, there is. So our hormones are derived from cholesterol. Our cholesterol is actually good for us as well. So our cholesterol gets broken down to progesterone, which then forms testosterone, which then gets aromatase to estradiol. But progesterone also goes over to form cortisol, and cortisone, our stress hormone as well. So actually if we have low progesterone, it can increase our stress hormones. So it's all very, very related, and there's a very close relationship with our stress and our hormones. So many women are told, oh, you're stressed due to other reasons or due to past trauma. But they might be, but actually the stress of not having your hormones is worse as well, because it's a physiological response. Heart palpitations and hormones, yes, very common. Lots of people we see have palpitations. They often can be worse actually at night time in the early hours when hormone levels are often at their lowest. There are lots of reasons why people can get palpitations. If you're getting them on exercise, you get chest pain, shortness of breath, you should absolutely see a doctor, because it could be due to another cause. But often we do find that palpitations improve with the right dose and type of hormones. What about those people who have a surgical menopause with residual endometriosis? So I have done an Instagram live talking about endometriosis. Sometimes the estradiol can flare up endometriosis if there's any left. So often what we do is give estradiol and progesterone together, and usually a continuous time for progesterone, so one each evening. Progesterone is very anti-inflammatory, and often testosterone as well is very anti-inflammatory. If some people are very sensitive to estradiol, then often we give testosterone and progesterone, and sometimes people don't need estradiol. It's all very, very different because everyone varies so much. The thing about endometriosis is what I'm sort of learning from my clinical practice and experience is that some people's endometriosis flares up more with synthetic hormones, so with contraception. So changing and switching to the natural hormones, especially progesterone, plus or minus testosterone, plus or minus estradiol, can be very beneficial for a lot of women with endometriosis. Let me just go to the next one. I've had ear popping ever since becoming perimenopausal. Is this normal? Also, someone else asked about ear eczema. Is that a menopausal condition? Well, we have hormone receptors everywhere, every single cell, everywhere throughout our body, including in our ears. A lot of people get symptoms such as tinnitus, or they might notice even some hearing changes, or the pressure in their their sort of pressure in their ear can change as well. Often we don't know how many symptoms are related to hormones until we give them back. So often I'll say to people in the clinic, let me replace your hormones in a physiological way, have the right dose and type for you, wait 3 to 6 months and then see what other symptoms are left. Any eczema, any dry skin, any eczema, psoriasis, any skin conditions can worsen in menopause because our hormones are very important for the way our skin functions. And I have done an Instagram live, so it's on my YouTube, about skin changes with hormones. Does systemic HRT help vaginal atrophy? So vaginal atrophy or genitourinary syndrome with menopause can be very, very common, affects most of us with time. Most people do improve with some systemic HRT, but around a quarter to a fifth of women still needs vaginal hormones as well. And increasingly I use vaginal progesterone, which is DHEA, which converts to estradiol and testosterone in the vagina, the vulva, the surrounding tissues as well. And it's quite safe to use a combination of systemic hormones and vaginal hormones as well. I'm in perimenopause and have endometriosis. Do you prescribe higher dose of progesterone? Well, like I said before, we always usually, if someone's still got endometriosis, give progesterone. Some people need a higher dose and some people we give it vaginally rather than orally. And I have done a YouTube all about progesterone as well. I feel my HRT is no longer working for me. My doctor tells me I'm already taking a high dose. Well, I've done some YouTubes about individualisation of doses as well. If you feel your HRT isn't working, there's a few reasons why this might be. Firstly, you might have started your HRT when you were perimenopausal and you still had some hormones in your body, and then actually adding in or with time your own hormones will decline, so often people do need a higher dose with time. It might be that you're not absorbing it as well through the skin. Our skin type, texture can change. Sometimes we absorb less in the winter months than the summer when it's colder. Our skin, the blood vessels are less on the surface, there's less of the hormone to be absorbed through the skin into the bloodstream. It varies so much, so sometimes it might not be the dose that needs changing, it might be the type, so you might need going maybe from a patch to a gel, for example. And sometimes people become testosterone deficient, so if this person's only on estrogen, then they might need testosterone as well. So it is about balancing hormones, and often that's why we review people at least every year, and we often do change the dose and the type quite a lot with women. 3 pumps of estrogen gel, but wake up every night feeling very hot. Do I need more? Possibly. It is worth then doing estradiol blood levels and then seeing, but you can wake up hot due to low progesterone and testosterone as well. And obviously there are other reasons, so it would be worth exploring that with your doctor. My doctor wants to stop my HRT. Where do I find evidence that it's okay to continue? Well, all menopause guidelines are very clear that we can continue taking HRT as long as benefits outweigh the risks. So for most of us, that is forever. We're just replacing a natural hormone. If you're taking body identical, the natural hormones, then they're very safe, they're very good in the body. Even low doses can be beneficial for our future health as well. And it's an individual choice taking HRT. People don't have to take it if they don't want to. You don't have to drive your car if you don't want to. You don't have to get up in the morning. There's all sorts of choices we can make as women, and taking HRT is a choice. But certainly if you want to take it and the benefits outweigh the risks, and for most women they certainly do, then you can continue taking it forever. I'm still having periods after 5 months on HRT. What should I do? Well, it depends on the type of HRT. Often when people have periods, we start off giving cyclical hormones, so that means the progesterone is given for 2 out of 4 weeks, so people will have bleeding. And then usually after about 6 months or so, we change it, so the progesterone is given every evening. That keeps the lining of the womb thin usually, so then there's no bleeding. And a lot of people usually are very happy not having bleeding. How do I know which treatment is right for me? My doctor knows nothing and has the same treatment. Well, HRT isn't a one size fits all. We are all different and our hormone needs vary so much. And certainly the way I prescribe HRT and we prescribe in our clinic is giving the hormones separately. So give estradiol, progesterone, testosterone separately. So you can really tailor make the dose for each person. And it is really important to see someone who understands the differences between the hormones. Which is better for recurrent urinary tract infections, Badgefem or estrogen cream? Actually, I would say Prasterone. Prasterone, the name in the UK is Intrarosa. It's a daily pessary of something called DHEA, which converts to both estrogen and testosterone in the vagina, the urinary tract, the pelvic floor, surrounding tissues. I find that it's just so good for women who have any vulvovaginal symptoms, but especially women who have recurrent urinary tract infections and urinary symptoms. So daily pessary, it is available on the NHS, but some areas still aren't prescribing it, but it is available to prescribe, and it can be very, very effective. Can I take estrogen cream alongside Tibolone? Yes, you can use vaginal hormones with Tibolone, but Tibolone, I did post about it this week, is a combination synthetic hormone that has actually been recommended not to be prescribed. Obviously some women might still benefit from it, but you are really better having the natural body identical hormones. I'm afraid to try 25 microgram estradiol patch after anxiety and low mood was really bad on estrogel pumps. Now everybody's very different, and obviously I can't give individualised advice. It might be that they with the pumps they weren't absorbed adequately. Sometimes people find if the dose isn't right, then they can get symptoms such as anxiety and other symptoms as well. So sometimes it's giving a higher dose, or it might be that this person needs more progesterone or testosterone and it's not an estrogen related deficiency causing the anxiety. So it's really, again, seeing someone who understands. How do you know if your Mirena coil is working with your HRT? So Mirena coil works on the womb to keep the lining of the womb thin to stop bleeding. It won't work systemically as progesterone. So often, even when people have Mirena, we still prescribe progesterone to have the effects throughout the whole body. But if people aren't bleeding, then the Mirena is definitely working for the lining of the womb. I have POI. Can I increase estradiol gel to 3 pumps before a blood test? Yeah, it depends on the clinical situation. Sometimes with the blood test, especially when people have estrogen gel, then you have to be really careful to wash your hands really carefully and not apply the gel on your arms the morning of your blood test, because the gel literally gets everywhere, and so you can often get contamination, so a spuriously high result if you use a gel on your arms. So it would be worth having the test and then talking to your doctor about the dose that's right for you. Can too much estrogen cause night sweats? Not usually, actually. It's very hard to have too much estrogen. Usually when we give a higher dose, it's just to get a physiological response in the body. People often have a higher dose or need a higher dose just to get the same amount through the skin. We know that low estrogen can cause night sweats, but actually so can low testosterone and even progesterone as well. So everyone thinks it's all about estrogen causing the vasomotor symptoms of flushes and sweats, but other hormones can as well. Estrogen blood test low on 2 pumps but breast tenderness on 4 pumps of gel. What can I do? Well, it's interesting. Breast tenderness can be related to estrogen dose, progesterone, and actually testosterone can be very beneficial for breasts. It often reduces breast tenderness. If we're increasing the dose and people are sensitive, we often increase the dose really, really, really slowly. And sometimes that's better. So if you go from 2 to 4 pumps and then you're getting some side effects, it might not be that you can't ever tolerate 4 pumps, but we would say just very gradually increase the dose rather than doing it too quickly. 1 year on HRT, 63 years old, very healthy, workout every day, lifestyle not changed, but I have some weight gain. Why is this? Well, there's lots of reasons why people can put on weight. If people don't have adequate hormones, then people will often put on weight because menopause is a cardiometabolic problem. Our metabolism changes when we don't have adequate hormones in our body. Our body tries to get estrogen from our body, and the only way it can really do it is from estrone from our fat cells. It makes a weak inflammatory type of estrogen called estrone. And that's often in the midline. So people tend to put on weight, Also, there's a shift in the way that we get muscle loss as well, and our body shape can change as well without hormones. So it really varies. So even with doing exactly the same lifestyle, if your hormones aren't adequately balanced, you might put on weight. So it would be worth seeing someone to see if you're on the right dose and type of hormones. And often we do a blood test, making sure people haven't got an underactive thyroid, or there's another reason for their weight changes. Does estrogen and testosterone help lower blood pressure? Yes. So I've done a podcast and an Instagram live about the cardiovascular benefits of hormones, and certainly the natural estradiol is very anti-inflammatory on the lining of the blood vessel, can open up the blood vessels, causing vasodilation and lower blood pressure. Testosterone can be beneficial as well. So a lot of people find that their hormone levels, when they've got their hormones balanced, their blood pressure reduces. So if you've got raised blood pressure, hypertension, and take medication, you can still safely use the natural hormones, and often people find their need for treatment reduces. My mother is 80 and now just discovering that HRT may be a great support. Is it too late or not? No one's too old to consider HRT actually. It's very different to the synthetic, the older types of HRT, which have a small risk of clot and heart disease with them. The natural hormones is just replacing natural hormones. We can start with a low dose, and we know even a low dose of estradiol can help strengthen the bones, and osteoporosis is so common, affects around 1 in 2 women. So actually anything that's going to be beneficial for our bones, but also probably our heart, our cardiovascular system, but also our brains as well. So a lot of people who start hormones when they're older find that they sleep better, they think clearer, they are less forgetful, and that can make a huge difference to their quality of life as well. So often we do see people in the clinic who are older, and we talk to them about trying some hormones. If they don't help, obviously they don't have to continue, but certainly they are usually safe. Can you talk about tinnitus in perimenopause? Very, very common actually, this ringing in the ears. It's related to the way our hormones work on our nerves, our physical nerves, which can be affected in tinnitus, and a lot of people find they improve with hormones as well. Do hormone levels and HRT affect thyroid function? Yes, they do. All our hormones they interact with each other. So our hormones will, estradiol, progesterone, testosterone, for example, will interact with insulin, which is another hormone in our body, and that's why there's an increased incidence of insulin resistance and type 2 diabetes when people don't have the hormones in their body. If people are menopausal and they have low estradiol, the body tries to work by having the hormones, and sometimes it puts more strain on the thyroid hormones. So people often find that their thyroid function is altered when they're menopausal, and having hormones back often improves the thyroid function as well. I've been on HRT for years now, and I have headaches, bleeding and tenderness in my breast. This lady sounds like she probably needs a different dose and type of hormones. Often when you get the balance of hormones right, it can really improve those symptoms, including headaches and migraines as well. How to stop heavy periods and PMDD in perimenopause. So a lot of people who have PMS or PMDD find that it worsens in perimenopause, and it's often before the periods come people feel a lot worse. And it's often supporting women by giving them maybe slightly more hormones for those few days. Increasingly we give more progesterone actually, and often it's not just tablet as the micronized progesterone, but of pessary. So in the UK we often give cyclogest, and some people need higher doses than other, especially on those few days where they're having awful PMDD. How does HRT work if you're having injections to stop your ovaries working? So some people are given injections of something like Zoladex, which block the hormones working. And now what that will do is stop any fluctuation of hormones, but it actually basically gives someone menopause, and a lot of people have a lot of side effects and feel dreadful actually with having no hormones in their body. So often what we do is give back the hormones, but give them in a steady state. So often give the estradiol, estradiol is often as a patch actually, so you've got a steady state, the progesterone and testosterone, so you don't have these fluctuations, and can be really useful as well. does estrogen help with fatigue? Often it does. All our hormones, when they reduce, one of the commonest symptoms is fatigue, and that's whether people sleep well or not, they can still get fatigue, and that can improve with estradiol, but also testosterone can often improve fatigue as well. What is the current thinking about adding in progesterone after total hysterectomy? Again, I've done a YouTube all about progesterone, and many women do still benefit from progesterone. I've already said it's basically the main hormone. Progesterone forms testosterone and estradiol, and a lot of people benefit from progesterone. It's an important hormone throughout our body. We have receptors that respond to progesterone in our brain, in our heart, and all throughout our body. So a lot of people actually feel better when they take progesterone. Sometimes people find they feel more anxious initially and then it settles down. But if you are finding that it's beneficial, then there's no reason not to take it. It is just a natural hormone. Can you use vaginal moisturisers alongside vaginal hormones? Yes, you can, but you just be careful that you're not using ones that are heavily scented or they've got lots of preservatives in them, because that can cause a lot of discomfort actually and pain. Excess fluid and bloating on Mirena and Eutrogestan makes me groggy. Do you have any other ideas? So for some women, progesterone can cause some fluid retention, can cause some side effects. So sometimes we give the progesterone vaginally rather than orally, and then it gets absorbed through the vaginal mucosa into the bloodstream as pure progesterone, and that often has less side effects, and it's about getting the dose right. Is one hormone more important than others in regards to reducing inflammation? So all our hormones actually can reduce inflammation. We have the cells that determine or work on our inflammatory system, especially our macrophages, have receptors for estradiol, progesterone and testosterone on them. And so actually they all have different effects, but they all affect our immune system. So our immune system works better for all three, with all three of those hormones are present. I have breast and ovarian cancer. People who have a family history of cancer, whatever cancer it is, can still usually safely take HRT. If people take body identical natural hormones, there hasn't been shown to be an increased risk of cancers with them. So that person might have an increased risk of cancer because of their family history, but taking HRT isn't going to increase that risk, and actually it might reduce the risk slightly. Even the WHI study showed that there was a reduction risk of bowel cancer, for example, that people seem to forget. People just focus on the breast cancer risk, which actually hasn't been shown to be there with the natural body identical hormones. What's the best dosage amount of testosterone and best to apply it? Well, the dose varies. Often we give we start with a low dose. It depends whether you're having the gel or the cream. Usually people put it on their thigh or their bottom. The commonest side effect, if people get side effect from testosterone, is some hair growth where you rub it on, just because it can stimulate the hair follicles. So people don't get systemic hair growth, but just where you rub it on. So that's why often the thigh. Some people actually also put it on the inside of their arm because they don't have hair follicles there. I'm on holiday and run out of Eutrogestan. Can I buy some in a French pharmacy? I'm not sure whether you can in France. I know in Spain you can. I forgot to take some hormones recently when I was in Spain and just went to the pharmacist and bought them over the counter. They were very cheap. No one asked me any questions. And it did really make me think, why is it so difficult for women in the UK to get hormones? I have to stop my HRT after a year. My doctor wants me to slowly come off it, but I don't want to. Well, you should see another doctor, because there's no reason usually why people have to come off HRT. It doesn't make sense. HRT has more benefits than risks for most people. There are many benefits for future health as well. So regardless if someone has symptoms, the benefits are still there for the bones, heart and brain and so forth. So it would be worth talking to another doctor. Surgical menopause. 10 years ago, my doctor says estrogen can cause heart problems. Is that true? Well, this stems back from the WHI study, where the synthetic type of hormones, the conjugated equine estrogens, the pregnant horse's urine estrogens, were associated with a small risk of heart disease when started in women more than 10 years after their menopause. But actually, when we use the natural body identical estradiol through the skin, it's not been shown to have this risk, and it shouldn't, because it's a physiological hormone. So people can still have it. So this doctor's talking about a type of HRT that you shouldn't be taking, really. Do I need progesterone following a total hysterectomy? I've talked about that already. Migraine. So I've just updated some information that's going to go on my website soon about migraine, and I will talk about that. But migraines can often get worse in perimenopause, and having the right dose and type of hormones can be really beneficial, as well as thinking about other lifestyle triggers. Magnesium supplements can be very useful as well. Micronized progesterone makes me feel like a zombie. Will it get better in time? So usually we say to take the micronized progesterone in the evening. Sometimes if people have side effects with taking it orally, we sometimes suggest taking it vaginally because it doesn't get metabolized in the same way as some people find having less then. Is there an age limit for the Mirena coil? No, if it's used as part of HRT, people can still have it replaced regularly. What's your thoughts on splitting Lenzetto into 3 sprays throughout the day? Yes, it can do the same with the estrogen gel. It's sometimes better giving it twice a day rather than all at once. In my clinical experience, Lenzetto doesn't get absorbed very reliably, and I tend not to prescribe it actually because I find that people's levels really vary, their symptoms really vary. It can be quite difficult to get the right dose with the spray. Is full body skin crawling, tingling a symptom? Yes, it can be. This formication is very, very common due to low hormones, and it does often improve. If my patch irritates me, will I absorb it? How can I stop this happening? It varies really. If the skin is very irritated, it might not absorb the right amount through the skin, so you might need to use a higher amount, or you could try changing to another type of patch or using the gel. Sometimes the skin where I put my patches becomes very red and sore, and other times it's absolutely fine, and I don't know whether it's my skin type or whether the batch of the patches changes with the glue. I don't really know. So do I need to come off HRT at 60? No, we've said this already, you don't have to. The contraceptive pill made me feel crazy. Is HRT likely to do the same? No, it's not, because the contraceptive pills contain synthetic hormones which act very differently into our body to the natural hormones. So a lot of people feel so much better when they have the natural hormones, even though they've had problems with the synthetic hormones in contraception. Could I be allergic to Vagifem? It's unlikely to be allergic to the estradiol in Vagifem because it's a natural hormone, but sometimes people can have reactions to the substances that make the tablet, or sometimes the estrogen cream or the gel. It's actually the preparation rather than the actual hormone, so it might be worth changing. How do you know when to start? If HRT regulates your periods, do they stop if you continue to take it? So starting HRT is a very individualised choice, but usually people take it when they start to have symptoms. You don't need to wait till your symptoms are really bad for starting HRT. And like I say, we normally give the cyclical HRT for about 6 months and then change to the continuous type of progesterone, so periods stop with time. Let's see, some of these are similar, that's why I'm not doing it. Had a blood test. Doctor said I should stop testosterone as levels are too high, but I feel good. So I have done an Instagram live about testosterone. Sometimes hormone levels can really vary. If someone has a slightly raised testosterone level and they don't have any side effects and they feel well, we usually just repeat it a few weeks later. I don't worry unduly because hormone levels can really change, and it's only a snapshot during a blood test. If someone's feeling well without side effects, we don't need to rush and change it. Be helpful to see information regarding blood sugar impacts of perimenopause. Yes, like I said, our hormones can affect the way our insulin is produced, and so a lot of people get sugar cravings when their estradiol level and the progesterone level is low. It's not something that's just in our heads, it's a physiological response. These hormones really affect the way that our insulin and sugar is metabolized in our body, so they work very, very closely together. Autoimmune diseases or flares almost in the week before my period. Why? Well, we know that people are more likely to have autoimmune diseases when they're in their 40s, when they're women, because it's probably related to hormones. the week before periods is when hormone levels decline, especially estrogen and progesterone, which really help our immune system to work properly. So often people find balancing the hormones in the week before their period can really improve those symptoms. So it would be worth seeing somebody who understands hormones. Is it normal to have bleeding on Everol sequi patches? Everol sequi is a type of hormones where the Everol bit is a natural Everol, a natural estrogen, and the sequi is actually a synthetic type of progesterone. They are given so people have periods, and so actually going to I would usually change people to pure Everol patches and then Nutrigestan, the natural progesterone, and usually take it continually, and then you won't have periods. Can Newson Health train up some menopause leaders to go out into companies and schools? Well, we've got our masterclass course, it's a masterclass that I've done that's available through my website, drlouisenewson.co.uk, and we are looking at doing more and more training, so you can get in touch with us through the organisation. Could my B12 deficiency be linked to menopause? Yes, it can actually. Iron deficiency as well can be linked because low hormones, our estrogen and testosterone can affect our iron metabolism, but also B12 folate as well. Nearly finished. Let's see. Can you use progesterone with local estrogen cream? Yes, you can. Sometimes we use the progesterone pessaries and then we use estrogen cream or like the Blissful gel if people have got external symptoms as well. So everyone is really different, and making it individualised is really important. Can testosterone help with tendon and painful joints? Yes, it can, because it's very anti-inflammatory, especially in the muscles and joints as well. I've been on HRT, different types to date, don't feel the levels are right. Well, you need to see someone who specialises in hormones to get the right dose and type for you. Let's have a look. Why is there still such a stigma surrounding HRT? I'm not really sure. I think it's probably because it's related to women and there's this confusion between the natural hormones and the synthetic hormones. Can frozen shoulder reverse with correct HRT doses? Actually, it can. It's usually women that have frozen shoulder, and often it's a combination of all three hormones. It can take a while, but they're all very anti-inflammatory, can be very beneficial. I had frozen shoulder and I had it injected about 3 years before I started hormones. I didn't even think about my hormones then, but since I've been taking hormones, I've not had any problems at all, and we see it a lot in the clinic. Do all patches have to be placed under waist height, or can you put them on your back or arms? So when they license the hormones, when you license a preparation, all they do is try it and see if it's okay and works all right in that area. So for example, the patches were applied below the waist, the gel was on the arms or legs, but what we're doing is just using the skin as a vehicle. We're using the skin as a way of getting a hormone through the skin into the bloodstream. So the skin of the thigh isn't really any different to the skin of the arm. So if you find your patches really aren't sticking or they're not suitable on below your waist, you can use them above your waist. It's an off-license way, but there wouldn't be any logistical reason why they wouldn't still absorb through the skin into the bloodstream. So sometimes it's just experimenting and doing what works for you. I've got some patients who are firefighters or people who are divers and wear wetsuits, and they find that in certain areas the patches just don't stick on. So experimenting a bit. We know there's a huge variation actually in absorption between different areas of the body. So some people might find they absorb better or worse in different areas. So it really is just working out what works for you. And we're all different, and that's good, isn't it? Isn't it great that we're all different? But it means that our hormonal needs and requirements are often different as well. And that's why it's so important to see someone who really understands, can treat you as an individual and enable you to have the right dose and type of hormones that you both need and want. So I hope that's been useful. I know I've spoken very quickly. I have rattled through a lot of questions. Some of them are repeat, so that's why I didn't answer all of them. But I hope that's been helpful. I'll post it on my grid and let me know more ideas that you want for future Instagram lives, and if they're helpful, of course. If they're not, then I won't carry on doing them, but it seems that people enjoy me doing them. So have a good week. Enjoy the rest of your Sunday evening, or wherever you are. You might be a different time zone, and look forward to speaking to you next week. Thank you.